Hi, folks. So I hope that you have, I don't really want to say enjoyed the lessons that we've had, the one on death and dying. I know that was kind of difficult. I did very much enjoy reading your thoughts on what you thought about the video with the hospice nurse. So, several of you actually thought that you might be interested in that one day. Most of you didn't, and that's totally okay. But, hopefully this has opened your eyes to seeing other careers and seeing, what all those careers do. There's a lot more to nursing or physical therapy or respiratory therapy or occupational therapy than just seeing patients given meds. But what we're going to talk about today actually does have to do with giving medications. So this is a short lesson. The notes are super short. I think they're like 2 pages. This will be a short video. There will be lots of pictures. And then there's a packet, okay? And the packet is on there as well. It's called Introduction to Pharmacology, Fact or Fallacy. So fallacy means false. So I will refer to that a little bit. And it's a great resource. I did get that from another teacher, but it's a great resource for you to have. So you can download that file and keep it. It will help you understand medications. So yet again, this is just an introduction to pharmacology and medical math. It's not meant to be totally inclusive, just to give you, just sort of a little bit of an overview of pharmacology. If you're interested in being a pharmacist or doing something with that, this will help you understand a little bit about what you would have to do. There is a lot of math involved in that. But even if you are, if you want to be a nurse or basically anybody that is trained to give medications can give medications. So, one of the first things on the little packet is only nurses can give medications to patients, and that isn't true. Trained or certified healthcare practitioners who may legally give medications include physicians, physician's assistants, paramedics, medical office assistants. A lot of times that medical office assistant is who's coming in to give you your shot, and they've had to calculate that medication. Practical, vocational, and registered nurses and other allied health specialists such as respiratory therapists. Respiratory therapists have to give a lot of medications, okay? So what you want to do is probably still going to include medication. All right, see if I can get it to work. Here we go. All right, so pharmacology is the study of drugs and their origin, nature, properties, and the effects that they have on living organisms. So we're going to look at the different places that drugs come from, what their origin is, how did we get them, what do they do, what properties do they have, and then most importantly, what effects, as in the therapeutic effects, but also the side effects on living organisms. So to give medications effectively and appropriately, we need to know why the drug is being given, how the drug works, and what effects to expect, and that does include side effects. So if you're giving a pain drug, what's your effect? Your desired effect is for them to not be in pain, right? But what could some of the side effects be as well? That could be nausea or vomiting. That could, depending on what type of pain drug it is, it could cause constipation. Patients need to know all of those things before they're given a drug. And, they're probably not going to ask you how it works, but they might. There is no way that you can know exactly every single drug. There are way too many drugs now. I can remember when I was in nursing school, we had to make drug cards. And we had a book about this thick. I think it's in my classroom. And the print on it was teeny tiny. And it came out, there was a new one every year that we had to buy. And it was a pharmacology book. Now there are so many drugs that they don't even print those anymore. I don't know if you'll make drug cards or not when you actually do clinicals. You may or may not. Because it's all on the internet, and you can, find a good resource for whatever drug it is that you're getting or that you're giving. And you can find out pretty much everything that you need to know about that drug before you give it. All right, so the classification of drugs. They're categorized under a broad classification and or a subcategory. So they can be classified in several different ways, but the most effective for healthcare is if they're classified by therapeutic use, okay? So you may see, like, if you look up a drug, you could see like pregnancy category A or pregnancy category B or pregnancy category C. Well, unless you're pregnant, that really doesn't mean anything to you, okay? So, but if we classify them as the therapeutic use, like blood pressure drugs, if you were to do like a search on WebMD for blood pressure drugs, it would come up with lots of different blood pressure medications. So that can be the most helpful way to classify them for people that work in healthcare, is by what they do. If they affect the body in similar ways, then they're going to be listed in the same classification. Okay, so going back to blood pressure medications, a large class of blood pressure medications are called beta blockers, all right? And so they block the beta receptors in the heart, I think, but I might have to go double check that, but they block those beta receptors. As a matter of fact, I'm just going to do that because this way you can look it up. And how do beta blockers work? It's probably in the nervous system. Beta blockers, medications that reduce your blood pressure. They work by blocking the effects of the hormone epinephrine, also known as adrenaline. Beta blockers can cause your heart to beat more slowly and with less force, which then lowers the blood pressure. So yeah, so here's the beta blocker. So all of these can be listed in the same category because they are all beta blockers, all right? And that helps us understand, okay, this is what that drug does. All right, I'm trying to let my little thing catch up with me. See if y'all can see me. Hello? Okay, if you can see me, that's fine. If you can't, that's fine too. Okay, so drugs that have several types of therapeutic effects can fit under several classifications. So there are a lot of drugs that, maybe it was made as a blood pressure drug. So I'm going to go back to blood pressure drugs. Beta blockers can also be used as migraine medications. So it could be under several different classifications. It could be under beta blocker for blood pressure, but then it could be also under a migraine medication, because several of those are used for migraines as well. All right. Okay, so generic name, this is going to be the common or general name. So when I show you a label, this will make sense in just a second. So it's going to be differentiated by lowercase letters. Uh-oh, did I go too far? Hold on, let me go back. Okay, so the generic name versus the trade name or the brand name, okay? So generic name, this is like, okay, for instance, Tylenol is a brand name. Acetaminophen is the generic name. All right, this is how you can go into Walmart and buy, the Equate brand of acetaminophen. It's still the same drug. It is the same therapeutic agent, acetaminophen, that's in the generic, which could be Equate or the CVS brand or whoever, as in Tylenol. All right, now some of their non-therapeutic ingredients are different, but the therapeutic ingredient of acetaminophen is exactly the same, okay? Now, so Tylenol is more expensive, right? Yes, and some people, they will just swear by their brand name drugs. Well, I mean, that's fine because the inactive ingredients can make a difference, and we'll talk about that a little bit more in a minute. But why does it cost more, and why do they sell it under two different things? Well, normally a drug that is, when it is first in creation or being made, or I say in creation, but when it's being, I guess created, for lack of a better word, they are Tylenol, or that company, which is I think Procter and Gamble, they are the ones that did all the research, they did all the clinical trials, they did all of those things, so and they paid for that to come up with the drug Tylenol, okay, or acetaminophen to use it for pain. So the government allows them 7 years to be the only people that make that medication. All right. So let's take the coronavirus where we are right now. All right. So whoever comes up with the vaccine fast enough, all right, they're going to have 7 years that they can make that vaccine or make a medication that treats it or whatever, that they don't have any competition. All right. Nobody else can make it. 7 years. And so that's why it's so expensive, because in that 7 years, they are trying to recoup the cost that they spent in making these medications and also in research to go to the next medication. It's a business, all right? So, keep that in mind. So they get 7 years to be the only people that make that medication. And then other companies can come in and make it as a generic drug. All right, so brand name, this is from that pharmaceutical company like Procter & Gamble for Tylenol. It's copyrighted and can only be used exclusively by that company. So no one else can, if you go to Walmart or somewhere and you're looking at the painkillers, Advil, and nobody else can make Advil except the company that developed it. Motrin is the same way. Now, ibuprofen is the generic name of both of those. The name that's in all caps has a trademark symbol, and I've got that picture on here. There you go. So there'll be a trademark symbol right there, differentiating that as the brand name. Okay, so here is an example. All right, so Zimuron injection. This is, right here, is the brand name, okay? So this is a brand. See, it's got the trademark symbol. Organon, this would be the company that made this and distributes it. This is the generic name, Rocurion bromide. So this generic name here, you can see it is in lowercase letters. Some of them, I took out a picture of Augmentin that it had the brand name and then the generic name in all caps. And so I took that one out because that one's kind of confusing. But Augmentin is a brand name for a type of antibiotic. All right, this video is posted separately, so I do hope that you'll watch it. I'll put a little question on there about, the guy is kind of boring. I know some of you think all my videos are boring. The guy talks kind of, he's British, I think, so he says in his laboratory, or instead of laboratory, I think that's how he says it. But it's about Alexander Fleming, and this is a classic picture of Alexander Fleming because these are like petri dishes. So, I mean, you can see how cluttered his office space was in his laboratory, but actually that's how we ended up with penicillin, so the video will explain that. So our sources of drugs come from plants and animals, they come from microscopic organisms, and then some of them are synthetic bioengineering. So originally, if you think back to the history of healthcare, which was all the way at the beginning of the year in August of 2019, most of, when we first started making medications, it all came from plants and animals. That was, they might have in a medicine man or something like that, that had their different sources of how to, they had different remedies, I guess we would call it. Then we have learned, about microscopic organisms now that can actually treat different diseases. Like, for instance, nystatin is a totally natural source, and it treats yeast. Okay, so it kills a yeast infection. And then now we have synthetic engineering. So this little packet that I gave you, and we're going to look more deeply at that, but it's got on the third page some of the sources of drugs. Like poppy seeds is where we get codeine, and morphine actually comes from foxglove. poppy, we get codeine and morphine. So pretty much all of our opioid drugs come from the poppy flower. Then foxglove is where we get digitalis, which is a heart medicine. Let's see, U mixed Taxol. I'm not familiar with that med. The stomach of other animals is where we get pepsin, which is a digestive enzyme. And then the thyroid gland from animals makes the thyroid hormone. And then a lot of drugs that are used to fight infection are made from microorganisms, like mold is actually. So that's a fungus that's used to kill bacteria. So, and then as we have gone on, we do have synthetic drugs, or they're bioengineered drugs as well. All right, so this is a link that I have for you, and I hope you'll go to this. It's very, very interesting. I'm just going to show it to you. This is just a document that I found, and so the purpose is related to using animal products for patient safety and cultural reasons. So it's but for our purposes, so it does have a lot in it about different religions. Like here's, the pages about different religions, and how they won't want certain things. So they may not accept certain medications. Like you remember we talked about Jehovah's Witness, they abstain from blood products. Islam abstains from pork or pork products. So if they are very devout, they may or may not want certain drugs. So we can go down here and see, these are all the drugs that come from pork. Oh my goodness. So these are the products and what they do. So a lot of these, heparin is an anticoagulant. It thins the blood, which is used all the time. These are made from pork, okay? So made from parts of a pig. So they may or may not want that, okay? You all have received the rotavirus, and that's a vaccine. A lot of vaccines come from animal sources. So all of you received probably all of these, the zoster virus. Y'all all got these, I'm certain of it. And these all come from pigs. These are all amylase, lipase, protease. These are all digestive enzymes. So those are very widely used, and those all come from a pig. All right, let's see what comes from a cow. This one, the top one, is an immunosupplement. There's some herbal supplements. These lactobacillus acidophilus, these are your probiotics or digestive supplements. Those come from a pig, from a cow. Insulin comes from a cow. So anybody that you know that's diabetic that takes insulin, that's going to come from a cow. This one is an antidiarrheal that comes from a cow. And then the varicella zoster vaccine. Sorry, I got my V's and my Z's mixed up. That one is your chickenpox vaccine. That comes from a cow. And then the hepatitis A vaccine comes from a cow. These collagen implants, the collagen implants for people that get plastic surgery, like in their face, to increase collagen in their lips or skin or whatever. They don't just make that in a lab. It actually comes from a cow. All right, here's some more bovine. So lots of vaccines, the pertussis or whooping cough vaccine, diphtheria vaccine, tetanus vaccine, hepatitis B vaccine, hepatitis A, rabies vaccine, all those, pneumococcal vaccine, which I'm sure y'all have all received, the MMR vaccine. So lots of vaccines, and there we are with the influenza. So that actually comes from a cow. All right, this is crazy, Chinese hamster. So we are using Chinese hamster cells for our ovary cells to treat all types of hormone therapy. So you can see there the different things, enzyme replacement therapy, pituitary hormones, immunomodifier, supportive therapy, pituitary hormone. So that we use I don't know who came up with deciding to use a hamster ovary, but anyway. All right, let's see. Then a mouse. So these are all the things that we get from actually mice. and what we use those for. Neoplastic, an anticoagulant, that would be a blood thinner, immunomodifier. Eggs, all right, I think all these are vaccines, so the different flu vaccines come from eggs. Then there's the H1N1 pandemic influenza vaccine. That one comes from eggs. That was H1N1 had been around, the swine flu, but made a resurgence in 2009. Not to where we are with COVID, I don't think, but it'll be interesting to see when all the data comes back. All right, from a horse. Oh, I think this is interesting. So, Premarin tablets. So, lots of women, after they have gone through menopause, will take Premarin. It's an estrogen, and that actually comes from a horse. These are all anti-venoms, snake anti-venoms that come from a horse. That's interesting. A sea snake anti-venom comes from a horse. Wow. So anyway, I wonder if that's because horses get bit by snakes a good bit. But anyway, so interesting what comes from that. And then here's just some others. We do chondroitin, if you've heard of that. Treats osteoarthritis, or arthritis actually comes from cow or shark cartilage. Digibind, or digoxin binding antibody, it's an antidote, comes from sheep. Glucosamine for arthritis comes from shellfish. Humira, which you've probably heard that's for they use it in rheumatoid arthritis. They use it in anything autoimmune. They can use Humira, and that comes from mammalian cells. So any mammal. Mononucleosis test comes from a guinea pig or a horse. So anyway, interesting where we get our medications from, if it's from a natural source. This one's always interesting to me. It comes from the pancreas of an ox. Wow. Okay. All right. And then gelatin, most of those little capsules that you swallow, that comes from cows or pigs. So anyway, now I'm sure some of you have been totally grossed out by that, but that is a great resource to know where your medications come from. All right. Okay, so pharmacotherapeutics. This is the study of the effects of drugs and how they work. It also describes the effects produced by a drug, and it determines what are pharmacotherapeutics. These companies are companies that do pharmacotherapeutics. They determine what dose is therapeutic, and then what are the toxic effects of a drug. Okay, so what do we need to do if there's an overdose, or at what amount do we end up overdosing? Okay, that's another thing that they look at too, like what is a safe dosage. All right, so this is a lot of pictures, routes of medication administration, not a lot of notes. They're in I think it's page 4 of the packet that I gave you. It gives you a lot more information about that, but we'll just look at these, if I can get it to work. Okay, so buccal, sublingual, or oral, this is all in the mouth, okay? So buccal, this is the tablet is placed inside the cheek. Sublingual is under the tongue, and then mouth, either to be swallowed, or the oral route, that would be swallowed and then go through the esophagus, the stomach, the whole gastrointestinal system. So why would you ever take a drug a different way? If it's all going in the mouth, why would you take it buccally or sublingually? Buccally is if the effects of digestion need to be avoided. So if swallowing the drug and it going through the stomach could end up destroying the drug, then it could be absorbed buccally. Sublingual is if you need it quickly. All right, that's when rapid effects are needed. You take something sublingually. So like Zofran, for instance, is a sublingual tablet. Zofran is used for nausea. So there's another reason you don't want to swallow that, because a lot of times if somebody's nauseated, everything is just coming back up. But if they can absorb it sublingually, then they can get the effects. Another one is nitroglycerin tablets that are for heart pain, for chest pain. That would be another one that's used sublingually. All right, inhalation. This is going to be when it's inhaled into the nasal cavity or the lungs, and you can usually see effects with this within 1 minute. All right, so this is for use with the respiratory tract. Okay, that's why you would inhale something. So an inhaler, that's so that you can get the effect into the lungs without it having to go through the entire body. All right. Okay, IV, this is to get it into the bloodstream very quickly. This is for situations requiring immediate effects. Like yet again, if you need to get some fluid in somebody really quickly, you're going to do it IV because they can't drink it as fast as we can get it into them through their veins. Okay, especially if they're dehydrated from nausea and vomiting and all that kind of stuff. It's also for drugs that can be rapidly destroyed by the body. You would also use IV. Antiarrhythmias, antibiotics can be given this way. An antiarrhythmia is for a heart if the heart is not beating correctly. That's called an arrhythmia. All right, there's another picture of the intravenous going in a vein. All right, another way is called IV piggyback or IV PB. So this is the main medication or the fluid. And you can see this one is higher than this one. That means if you've got, basically, if you lower this one, the one that's higher is going to go in to the body first. So a lot of times if they have to have antibiotics, we'll keep the fluid going just to keep that vein open and then give them antibiotic through what's called an IV piggyback. And then when this one runs out, this one will start going again. Okay, it's just used by gravity. All right, and then injection, which you guys got to practice injection a couple different times. So subcutaneous injection, that is the one where we practice doing the TB skin test, but also a subcutaneous is going to be, if it's just a little bitty tiny needle, okay? So this, you don't ever have to do a or intradermal. I'm sorry, that's what we did with the TB skin test. But our needle was very small too. So like a subcutaneous injection, I'm not going to use a big needle on that. So I won't have to go in at a 45-degree angle. I'll use a much smaller needle so that I'll only go into this subcutaneous space. And then intramuscular, that's the one that uses the long needle for different antibiotics, whereas like someone that's getting heparin or if they're getting insulin or something like that, you're going to use a small subcutaneous needle. All right, topical, this is on the skin, so you would use that for like your Benadryl creams or anything that you want to put topically. A lot of times that you're going to put that right where the whatever issue it is you're having, or like an antibiotic can go on topically. A transdermal patch, now these are really interesting. They do transdermal, means it goes through the skin. So this one is most likely for a nitroglycerin patch, or it could be a pain patch. But there's all kinds of transdermal patches. They even use these for hormone therapy. Even for some ADHD medicines, they use a transdermal patch. This just keeps a same level of whatever medication it is in the body all the time, as opposed to it having to go through the digestive tract and all that kind of stuff. All right, and then suppositories are used rectally. Lots of reason to do a rectal a medication rectally. If they, Phenergan is given rectally. Phenergan is for nausea and vomiting. That looks like it's a hydrocortisone. If the patient can't swallow, then they can give their medication rectally. So you can even give Tylenol rectally if they can't. If it's a child and they can't swallow, or you can't give them enough Tylenol, you can give it rectally. It works faster for pain or fever. All right, so on the next video, we are going to work on some drug calculations. So take a look at that packet. It's the PDF that I put on there. It's also got some rules for medication mathematical calculations. Whoops, not sure if you can see this or not. So look over that. But you can see that the drug is giving you, it's telling you that it's 400 milligrams per 5 milliliters. Well, what if you only needed to give them 250 milligrams? Then how many milliliters are you going to give them? So we're going to work on that together in just a moment. All right, there's several other pictures here I'll flip through. See, this tells you that there's 200 milligrams and 40 milligrams of, this is a combination drug, per 5 milliliters. So what if you only needed, if you needed 100 milligrams and 20 milligrams, well, that's easy. You just half it. But what you needed 125 and, that one's where you're going to have to do a little bit of drug calculation. All right. Heparin, that's a common blood thinner. Okay, all right. So the next video we'll do some drug calculations.